Welcome to Undoing Segregation, featuring Color of Law author Richard Rothstein. Hello, and my name is Erica Burrows-Girardi. And this webinar is the second in a two-part series entitled Healing Segregation for Health Equity. We kicked off this series last month with Segregation, a Threat to Equity, with Doctors Tiffany Manuel and Christine Maganda. They helped us examine the historical drivers of segregation and the measures that show just how complex segregation is. We also talked about the domino effects that lead to health inequities. This webinar is available on demand now at countyhealthrankings.org. And if you haven't seen it, I would encourage you to watch it. We'll include a link to it in your resource guide. CHR and our webinars reflect the values that we hold as part of the University of Wisconsin Population Health Institute. Values of collaboration, integrity, excellence, innovation, inclusion, and courage. These are values we aim to model during the webinar, and we hope that you will too. With that, I'd like to introduce you to the team that's going to aid in your learning experience today. And I'm going to start with Joanne Lee with Healthy Places by Design. Hi,
Thank
Joanne.
you. Hi, Erica. Thank you so much. And hello to everyone out there in our audience. Thank you for sharing time with us today. And we invite you to join the conversation today and engage with us during this webinar. And there are two ways to engage with us. You can ask our guest speaker questions by using the Q&A box. We will answer as many questions as we can during the live webinar. You can also engage with other participants in the group chat. And the group chat is really where you can do exactly what you're doing now, introduce yourselves, comment on learnings, or share your knowledge and experience on the topic with others who can see the chat. But again, please use the Q&A specifically for questions to pose to our presenter, and we'll try to address those during the live Q&A time. I also want to mention that County Health Rankings and Roadmaps Jesse Souls is joining me today in the Q&A box, and Jesse is going to help me respond to as many of your questions as possible. Right now, I want to introduce you to Colleen Wick, who will talk a little bit more about how you can use the chat box to engage with us.
Thank you, Joanne. Hi, everyone. Like Joanne said, I will be in the chat. So please use the chat to share knowledge or respond to questions we may ask you. Please join us in making the chat space welcoming by adhering to these guidelines. Share successes, lessons learned, relevant resources, and links. Please engage in a respectful dialogue. Our chat conversations tend to be very engaging, as you could probably see from the chat window going off right now. So if it's too distracting for you, simply just close the chat window. Please know that views expressed by speakers and participants are their own. They do not represent CHR&R or Healthy Places by Design. Again, if you have questions for the panelists, please use the Q&A box. Now I will pass it to our technologist, James Lloyd.
Thank you, Colleen. I'm so happy to be here and support this topic today. And as technologist, if you have any issues with the technology, the sound, or the video, please, again, put something in the Q&A pod, and I'll work my best to make sure you have a good experience. So, Erica, with that, I'll hand it back to you.
Thank you so much, James, and thanks to the entire production team for all of your hard work with our webinars. And I'm so excited, Colleen, to hear that folks are active in the chat, so that's exciting to me. Segregation is the policy of keeping one group apart from another and treating them differently, especially because of race, sex, or religion. Segregation exists in many forms. Examples include racial and ethnic segregation, economic segregation, and residential segregation. Today, we'll focus on residential segregation. And let's be clear, segregation impacts all Americans. There is a domino effect stemming from segregation that limits opportunities for all of us to achieve our best health and well-being. But it doesn't have to be this way. Healing is possible. We don't have to be stuck in a cycle of oppression that harms not only the oppressed, but the oppressors. We can dismantle and transform the systems that brought us to this point. So I'm pleased to be able to continue this study of segregation and what healing looks like with today's guest, Richard Rothstein. Richard Rothstein, I was going to call him Mr. Rothstein, but he said I could call him Richard. So thank you for that, Richard. Richard is the New York Times bestselling author of The Color of Law, and he is also a distinguished fellow of economic policy of the Economic Policy Institute and senior fellow of the Thurgood Marshall Institute of the NAACP Legal Defense Fund. Now, in June, Richard and his daughter Leah published Just Action as a follow-up to The Color of Law. So welcome, Richard, welcome, and thank you for joining us today. I know you're going to share like lots of nuggets of wisdom. And I want to let you all know that you can read more about Richard by visiting the webinar resource page that Colleen is chatting out, because his bio sketch is there for you to check out. Now, I've actually read Just Action, and it not only offers insightful context around racial segregation and how it became so entrenched in our society, it actually reads like a guidebook describing a series of practical strategies to begin undoing the harmful legacy of residential segregation. And so these are just a few quotes that I noted that kind of seem to be running themes, if you will, throughout the book. Residential segregation underlies our most serious social problems. An activist produces power and policy change, not mental change. The change we need requires both place-based and mobility approaches. We all do better when we're not separated from one another and learn from the past. In other words, Richard and Leah argue that now is the opportunity to be intentional about not repeating those policies and practices that brought us where we are today. Furthermore, they argue that we must adopt policies and practices that compensate past harm. That's how we heal. So, needless to say, I'm looking forward to Richard's talk, and then right after the talk, we will have a discussion group like we typically do after every webinar. And this is how we're going to unpack what we're going to hear today. So please plan to continue to join a discussion with us. During the video intro, you heard about our discussion groups that follow the webinars. They're facilitated by Joanne, and they're always engaging, giving you the opportunity to share and learn from others. So toward the end of the webinar, Colleen's going to chat out information so you can link to the discussion group. So with that, I want to ask Richard to join us and just let me again thank you for taking the time to share some wisdom with us. The book was fascinating, by the way.
Well, thank you very much. Thanks to all of you for joining me today in this discussion. As you know, just heard, in 2017, I published a book called The Color of Law. Its purpose was to demolish a myth that we all held. I did, as well as I'm sure all of you, and that is that we have something in this country called de facto segregation. The fact that we live in separate neighborhoods by race. Every metropolitan area has clearly defined areas that are either all Black or mostly Black, clearly defined areas that are either all white or mostly white. And the reason that we live in really an apartheid society is because of private activity. It's because maybe bigoted white homeowners or landlords refuse to sell or rent to African Americans in predominantly white neighborhoods. Maybe it's because private businesses like banks and realtors and developers refuse to sell or rent to African Americans in white neighborhoods. Maybe it's because of people just like to live with each other of the same race. That's why we're so segregated. We feel more comfortable that way. Or maybe it's just an economic thing. African Americans, on average, have lower incomes than whites, not by a whole lot, but they have lower incomes. And therefore, many African Americans can't afford to move to white middle-class neighborhoods. All of these individual, bigoted, discriminatory practices and ideas, self-choice, is what's created segregation. And we tell ourselves that what's happened by accident can only unhappen by accident. The name we give it, as I say, is de facto segregation. And because it happened by accident, we don't feel any obligation to undo it. We think it's too bad. Most of us think it's too bad we live in such a segregated society, but we don't have any obligation to do something about it. Well, the purpose of the color of law was to demolish that myth. It turns out to be yet other myth. The reason we are so segregated in this country, the reason we are, as I say, an apartheid society when it comes to neighborhoods, is because of racially explicit, conscious policy on the part of federal, state, and local governments that were designed to ensure that African Americans and whites could not live near one another in any metropolitan area. As I say, this was a race-conscious policy of government. It was unconstitutional. It was illegal. But nonetheless, it was pursued for much of the 20th century and caused the racial boundaries that we have today. And the effects today are ongoing, not only in health, but in every other area of American life. Well, I don't have time to describe all of the many, many federal, state, and local policies that were responsible, but let me just pick one or two and then move on to a book that I recently published in collaboration with my daughter, Just Action, which talks about what we can do about it now that we know that it was created intentionally. Well, perhaps the most powerful policy that the federal government followed to ensure that we be a segregated society was one that it enacted, it imposed in the immediate post-World War II period. It actually started a bit before that, but it ramped up after World War II. It was a program of the federal government to move all white, lower middle class, working class families out of urban areas into single family homes in all white suburbs. At the time, we were an urban country. The only people living in suburbs were wealthy people. The suburbs that we know today had not yet been created. But there were millions of returning war veterans coming home, both blacks and whites. They, like others, were settling in urban areas because that's where the jobs were. We were a manufacturing economy at the time. And factories needed to be located near deep water ports and railroad terminals to get their parts and ship their final products. So anybody with a job in the post-war economy had to live close enough to those factories to walk to work, maybe take short streetcar rides. Not many had automobiles. People who worked in banks and insurance companies and all the service industries of those factories also had to live in those urban areas. Well, the federal government embarked on a program to move the whites only out of those urban areas into single-family homes in all white suburbs. The homes were inexpensive. African Americans and whites could easily have afforded, both of them easily afforded to live in these homes, but only whites were permitted and subsidized to do so. African Americans were prohibited from doing so. Well, in my book, The Color of Law, I give as an example, perhaps the best known of these developments, and this was Levittown, east of New York City. The 17,000 homes in one place, east of New York City in Nassau County. The builder, William Levitt, could never assemble the capital to build this giant development. No bank would be crazy enough to lend them the money. They thought it was a crazy idea. They thought that nobody was going to want to live in these suburbs. We were an urban country. The only way that Levitt could buy the land and build 17,000 homes, for which he yet had no buyers, was to go to the federal government, to the Federal Housing Administration and Veterans Administration, two federal agencies, and request a bank guarantee for his loans to construct this project. The Federal Housing Administration and the Veterans Administration were willing to give him that guarantee. He had to submit his plans for the development, the construction materials he was going to use, the layout of the streets. But the FHA and VA also required him to make a commitment never to sell a home to an African American. This was not the action of rogue bureaucrats working in the Veterans Administration or Federal Housing Administration. It was written out in a policy manual. It was called the Underwriting Manual. In The Color of Law, I have excerpts from that underwriting manual. The manual said that you couldn't recommend for a federal bank guarantee the proposal of a developer, if he was going to sell to African Americans. The manual went so far as to say that you couldn't recommend for a federal bank guarantee a loan to a developer of an all-white project if it was going to be located near where African Americans were living. That's what the federal policy manual, written manual, said. The notion of de facto segregation is nonsense. This was a blatant violation of the constitutional responsibilities of the Federal Housing Administration and Veterans Administration, violation of law, and it determines the racial landscape of today. It's never been remedied, violation though it was. Well, the homes that were created, not just Levittown, but in these suburbs all over the country, encircling every downtown area, they were inexpensive at the time. In Levittown, this is true of all of them, they sold at the time for around $8,000–9,000 a piece. In today's money, that's about $100,000. Any family with a job in the post-war economy, with a Federal Housing Administration or Veterans Administration mortgage, subsidized mortgage, could afford a home for $100,000 with a 30-year or 20-year mortgage at that time. Whites were permitted to buy those homes, African Americans prohibited. Well, as you all know, in every one of the cities where you live, in the suburbs that surround those cities, those homes do not sell today for $100,000. They sell for $200,000, $300,000, $400,000. In some parts of the country, $1 million, $2 million or more. The white families who bought those homes, they didn't expect to get rich by buying these homes. They were looking for a place to live. We had a housing shortage. But in fact, they did get wealthy, but from the appreciation and the value of their homes. Over the next couple of generations, they gained equity from this enormous appreciation, rise in value. They used that wealth to send their children to college. They used it to perhaps take care of temporary emergencies, maybe temporary unemployment or maybe a medical emergency. They used it to subsidize their own retirements. And most importantly, for our purposes, they used it to bequeath wealth to their children and grandchildren, who then had down payments for their own homes. African Americans were prohibited by explicit written federal policy from participating in this program that generated wealth, unintentionally, but generated wealth. The result is that today, African American incomes nationwide, on average, are about 60%, 60% of white incomes on average. There's a big gap there. There's a different story behind that, but it's a 60% ratio. You would think that if there was a 60% income ratio, there would also be a 60% wealth ratio. People can save the same amount of money from the same incomes. But in reality, although African American incomes on average are about 60% of white incomes, African American wealth, household wealth, is about 5% of white wealth. And that enormous disparity between a 60% income ratio and a 5% wealth ratio is entirely attributable to unconstitutional federal housing policy that has never been remedied, that we as Americans have an obligation to remedy because it is a violation of our Constitution. It's an assault on our citizenship rights as Americans. Well, that wealth gap and that segregation was created by this policy, and there were many, many others, underlies much of the racial inequality we have today. I know that many of you in this webinar are particularly concerned about health outcomes. This is a big cause of it. African Americans who are locked into urban areas, close to industrial facilities, more pollution, more overcrowding, have worse health on average than whites, typically. Not everybody, but on average. I used to be, before I wrote this book, I used to be an education columnist, a writer on public education. And I tried to explain to people why we had an achievement gap between African American children and white children in school. Why do African American children, on average, perform at lower levels than white children? And I gave many, many, many examples of why this is the case, but I'll give you a couple from the health area. African Americans in urban areas where they are locked in by these federal unconstitutional policies, African Americans have asthma at 4 times the rate of whites. African American children have asthma at 4 times the rate of white middle-class children. They have asthma at 4 times the rate of white children because they live in more polluted neighborhoods. They have more diesel trucks driving by their homes, more poorly maintained buildings, more empty lots kicking up dust. The result is, and this again is averages, I'm only talking about averages, not in every case, but the result is that children with asthma are more likely, not in every case, but more likely than a child without asthma, to be up at night wheezing, coming to school drowsy the next day. If you have 2 groups of children who are identical in every respect, same racial backgrounds, same income, family incomes, but one group has a higher rate of asthma than the other, that group is more likely to have lower test scores than the group without asthma, simply because it's, on average, drowsier. It doesn't make a big difference. Asthma is not a big cause of the achievement gap, but then you began to add up all of the other causes, some health, some in other aspects of life, lead poisoning, stress, all of these impacts on African American children that bring them to school with less ability to take advantage of what schools have to offer are the important causes of the achievement gap, and it's all predicted by the segregation that was imposed by the federal government in the 20th century. Well, many other policies that the federal government followed, as well as state and local governments. I'll mention one more very briefly. Public housing, something that we all misunderstand. We all think, as I did before I began to do this research, that public housing was a place where poor people live, lots of single mothers without jobs in the formal economy, lots of young men without hope, lots of police activity. That's not how public housing began in this country. Public housing began in this country during the New Deal in the Roosevelt administration, during the Depression. It was a program primarily for white working and lower middle class families, not because they couldn't afford housing, but because there was no housing available. In the Depression, construction was not going on at the rate it needed to provide housing for the population that needed it. So the Public Works Administration, the first New Deal agency, built the first public housing in this country, and it segregated it, creating segregated communities, segregated projects, frequently in some of those downtown areas that hadn't been segregated before, where blacks and whites were living in relatively close proximity. But everywhere that the federal government built the first public housing, and then on for the next 20 years, it created separate projects for whites, separate projects for African Americans, creating a pattern of segregation that persists to this day in many of these communities. Also, an entirely unconstitutional, unlawful policy on the part of the public housing agencies and the federal government throughout the 20th century into about the 1970 or so. By that time, most whites had been moved out of public housing into urban areas, into suburban areas rather, that I described before. The only people left in many public housing projects were African Americans. It became untenable to have projects built for African Americans that had long waiting lists because the housing was so scarce, and projects built for whites that had large numbers of vacancies. Eventually, the public housing authorities had to open up all of the projects to African Americans. We concentrated the most disadvantaged people in these projects. They eventually became dysfunctional. They were dynamited, and public housing came to be known as a place where you warehouse the poor, rather than the kind of mixed income, mixed race projects that could have existed previously. Mixed income projects did exist previously separately for whites and blacks. Another unconstitutional policy followed by the federal government. Well, I wrote this book, The Color of Law, published it in 2017. I gave many talks like this, and people read the book, and they all asked me, well, what can we do about it now? And although I'm an old man and I wanted to retire, I figured I had to write another book giving them some advice. But I didn't have the experience. I'm a historian, not a policy expert, a housing policy expert. So I had to recruit a co-author. I found the most qualified person I could, my daughter, who actually had been a consultant to housing developers, knew a lot more about this topic than I did. And we co-authored a new book called Just Action, which describes what ordinary American citizens can do in their local communities to begin the process of redressing segregation if they organize to do so. Just Action is aimed at citizens. It's not aimed at policy experts. It's not aimed at think tanks. It's aimed at citizens who can get together in their own communities to create organizations that will challenge the segregation in their communities. The reason we were inspired to write this book was in 2020, 20 million Americans participated in Black Lives Matter demonstrations. They were whites and blacks, suburban and urban, people of other ethnicities, young and old. And yet when those Black Lives Matter demonstrations were over, most of those people went home, put Black Lives Matter signs on their lawns, and didn't do anything further to actually make Black Lives Matter by challenging the segregation that underlies even police violence in this country. Well, part of the reason why they did that, why they went home and did nothing further, is because they didn't know what to do. And so Just Action gives dozens of examples of local activities that people can do in their own communities if they organize. Leah and I are also supporting an effort to put organizers in communities to help create those kinds of organizations. As it happens, it's called the Redress Movement, and it has organizers now in 3 experimental places: Milwaukee, Charlotte, and Denver. If any of you are in one of those places, I would appreciate it if you'd let me know. And I will put you in touch with the organizers in those communities, and you can see if there's a way that you can get involved in efforts to redress segregation. Let me give you just a couple of examples of the kinds of things that could be done at a local level to make a significant dent in residential segregation. Although, and it's important to say this, although the segregated patterns that I described before were primarily created by the federal government and the kinds of policies I was describing, once it was created, it's local practices and programs that sustain and reinforce it and maintain it. So there's enormous opportunity to take action in local communities to redress segregation. Let me just give you a couple of examples that we describe in Just Action that will give you a sense of how much opportunity there is to take this kind of action. You probably don't know, or will probably be as shocked about this as I was when I learned it, but African American homeowners, people particularly living in predominantly Black neighborhoods, pay property taxes at a higher rate than white homeowners living in predominantly white neighborhoods. Well, the reason is if you have 2 groups of people who are in different social and economic circumstances, you can have race-neutral policies that affect them differently because of the circumstances that they're in. And those race-neutral policies can frequently reinforce and expand segregation. The reason that African Americans pay property taxes, if they own their homes, pay property taxes at a higher rate than whites do, is because the assessment system is in effect discriminatory, not in intent, but in effect. County assessors, city assessors evaluate homes, assign a value to them, and that's the basis for the taxes, for the tax rate that homeowners pay. Well, most counties, most cities don't do a reassessment every single year. They do it every few years, in some cases every 20 years. In that intervening period, either relatively short or relatively long, homes in white neighborhoods appreciate in value, typically faster than homes in Black neighborhoods. That means that over time, the market value of homes in white neighborhoods is farther above their assessed value than the market rate of homes in Black neighborhoods. The result is that because the tax rate is based on the relationship between assessed value and market value, the gap is so much greater in black neighborhoods than it is in white neighborhoods as it is in black neighborhoods. African Americans are paying a higher effective property tax rate. That's paying more tax dollars per dollar value of their homes in the market than whites are. It's a discriminatory system. It's well known. It's acknowledged by county assessors. I don't know if any of you are in Chicago, live in Chicago. I know you're identifying where you're from in the chat, but I can't read the chat and talk to you at the same time. The county assessor in Chicago, we quote him in our book, Just Action, acknowledges that he's operating a discriminatory system. He says African Americans are entitled to refunds. They are entitled to refunds. They're entitled to compensation for the excess taxes that they've paid. But nobody's going to make the school districts and the libraries and the fire departments and all of the other agencies that collect money through the property tax system, nobody's going to make them provide refunds to African Americans who've been overtaxed unless there's a popular movement that is going to create the kind of pressure that the civil rights movement created in the 1960s to force action on the part of public authorities to redress this aspect of segregation, providing refunds to African American homeowners, and to create a change in the property tax system going forward so that it doesn't create this ongoing inequity. The federal government has nothing to do with tax assessments. This is all a county and city problem. It's a problem that's based on the segregation that was created by the federal government. But the solution is not federal. It's at the county and city level, and local citizens can take effective action to fix this. I'll give you another example. Taking an example from home ownership. As you may know, related to the unconstitutional system I described before, only about 40% of African Americans own their own homes, whereas about 70% of whites own their own homes. Well, if African Americans and whites both attempt to buy a new home, whites are much more likely to have owned a former home than African Americans, simply because the home ownership rate is so different between these two groups. Well, when you try to buy a home, you have to apply for a mortgage. And whether you can get a mortgage and what rate you get on your mortgage depends on something called your credit score. We have a discriminatory credit scoring system. Again, not in intent, but in effect, because we have two people who are in very different, two groups of people in very different circumstances. If you apply for a mortgage and you're white, in 70% of the cases, you're a previous homeowner. As a result, the credit scoring system, the credit agencies who collect data on you, know whether you've paid your past mortgages on time. The banks that issue the mortgages, the mortgage companies all transmit these data to the credit reporting agencies. And if you have a good payment record, you've always paid your mortgages on time, you get a good credit score, and therefore you're eligible for a mortgage and at a low rate. If you've not owned a home before, typically of African Americans, only 40% of them have. If you've not owned a home at all before, you don't have a record of mortgage payments that can be transmitted to the credit scoring agencies. Now, of course, you've paid rent, but if you've paid rent on time every month all your life, you get no credit in your credit score for it because the credit scoring system does not collect information on rental payments. It only collects information on mortgage payments. Well, this is a discriminatory system. African Americans who have good credit because they've always paid their rent on time can't get a mortgage because their credit is not considered good. They can't, if they do get a mortgage, they can't get a good rate. It's a discriminatory system. Now, this has been widely known for a long time. A couple of years ago, Fannie Mae, the government agency, the quasi-government agency that finances banks to issue mortgages, announced that it would now permit applicants for mortgages to submit their own rental payment history. Now, this is a discriminatory burden in effect in itself, because homeowners mortgage applicants who've owned a previous home don't have to have the responsibility of submitting their mortgage payment history. The banks just turn that over. But Fannie Mae said it will allow renters to submit their rental payment history and have that counted towards their credit score. It's a burdensome system. Not everybody will be able to do it. Not every individual has kept those kinds of records, but it's at least a step forward. Fannie Mae announced, when it announced this program, that had rental payments been considered for the previous 3 years, and it just announced this a couple of years ago, had rental payments been considered in mortgage eligibility, the 17% of all of those who had been turned down for mortgages when they applied would have received a mortgage had their rental payments were considered. Well, if Fannie Mae is able to announce that 17% of all those who would turn down for mortgages would have received it if their rental payments had been considered, Fannie Mae must know who those 17% are. And the local banks that issued and processed those mortgages know who those 17% are. Those 17% are entitled to compensation from the banks from the discriminatory denial of mortgages that they suffered. They're entitled to favored treatment going forward. But again, without a local community group that is going to conduct a careful, considered campaign against those banks to force them to compensate those whom they discriminatorily denied mortgages to, it won't happen. The banks are not going to do it voluntarily. Well, there are many, many other policies in just action that we describe. Land trusts is one of them. Many communities now are in urban areas are suffering gentrification, displacing large numbers of previous residents from the communities where they live. Displacement is not inevitable. We know what to do to prevent it, or at least to minimize it. We're not doing it, not because we don't know what to do, but because there's no political pressure at a local level to make sure that we do it. I just mentioned one of the things that could be done is land trusts. There are many, would describe one as an example in Just Action. There are about 200 of them around the country. These are nonprofit organizations that are given grants by both foundations and local governments to buy up land. Today, it's mostly in urban areas that are not yet gone through the process of gentrification, and then they sell homes on those land, on that land, for the value of the home alone, not for the land, making the home affordable to particularly disproportionately African American families. It enables them to buy a home. They don't gain the kind of equity that you would if you bought a home and owned the land as well. They only gain the equity from the appreciation in the home and from the mortgage payments that they've made, the principal portion of mortgage payments that they made. It enables them to remain in the communities where they lived as homeowners and not be displaced. Another policy, local policy purely, it exists in many places, but not nearly enough. Another one is inclusionary zoning. Local ordinances that require developers to set aside a share of units in their projects for both low and moderate income families. And hi, Erica, are you stopping me now?
No, go ahead, finish.
Inclusionary zoning requires developers to set aside a share of those units for low, moderate income families. Well, there are many, many other policies that we describe in Just Action. I hope you'll look at the book and consider whether in your own communities you can band together with your friends and neighbors to try to create a movement to implement some of them and to force the implementation of some of them. I want to say again that if you live in Milwaukee, Charlotte, or Denver, I can put you in touch with an experimental group that is trying to do just that. And with that, I will stop and I'd be glad to answer your questions.
Thank you so much, Richard. I appreciate everything that you've had to say. I just want to offer a couple of reflections on Just Action, and then I'll share some information about our What Works for Health group. But I remember reading the book, and I remember thinking how easy it is to read the book. It's a very heavy topic, but you and Leah have done such a wonderful job at writing. It reads like a guidebook on how to actually take action. And I love that. A very, very, the information is important, but quite surprisingly, a very easy read. Um, and thank you for the larger font. I'm getting older, so I really appreciate it.
Oh, you're a young child, if you ask me.
We're going to get to some questions for Richard in just a second, but I kind of want to pick up where he left off, and this is only going to take a second, but we have a database, a very rich database called What Works for Health. And in the book Just Action, which I just told you is an awesome resource, but Richard and Leah talk about these place-based and mobility approaches. These are strategies that you can use to actually just take action. And so I want to talk about that because What Works for Health is such a wonderful database. I mean, it includes over 400 strategies that are evidence informed. We have a team of analysts that actually search or comb through the evidence and conduct a targeted literature search, assess the strength and quality of the evidence that they find, assign an evidence rating and a disparity rating. And the evidence rating summarizes the strength of the evidence supporting the strategy's effectiveness, and the disparity rating indicates the strategy's potential to have an impact on health disparities. Some of you probably used What Works for Health, but interestingly enough, you are going to find these strategies, the same strategies that Richard touches on in Just Action. Here's some examples of a place-based strategies. There's a K through 12 school finance reforms, which involves changing state-level school and finance systems to increase funding for school districts that serve large populations of students from families with lower incomes and students of color with disabilities, special needs, or limited English skills. You'll also find this in What Works Well, mixed use development. We often use zoning regulations. You heard Richard talk about that to support a combination of land uses. For example, supporting developments that include both commercial spaces and housing. We call these place-based strategies because they improve existing conditions. This is one way to redress segregation. Now, another way is through those mobility approaches. Now, keep in mind, that said, that was one of those running themes in this book. The authors contend you cannot redress segregation unless you look at place-based strategies and you look at mobility strategies. He calls them approaches, we call them strategies. But here you see housing reparations, which increases subsidies for financings and paths to home ownership. You heard how Richard talked about Black homeowners we have less Black homeowners than white homeowners. We need to level the playing field. Also, this is an opportunity to issue formal apologies for discriminatory housing practices. And we contend that issuing those formal apologies for those housing policies are not enough. We have to increase the subsidies to allow for greater home ownership for people of color. And then lastly, I want to point out inclusionary zoning. This is exactly what Richard was talking about. Those policies that require developers to reserve a percentage of housing units for residents with lower income. So if you're pondering solutions that can address residential segregation in your community or ways to make a case for it with partners or even elected officials, What Works for Health is a great resource to consider. Now, we're going to include a link to these strategies on your resource guide. And then I also want to mention in our discussion group, I've got a treat for you. Guess what? Richard told me he's coming to our discussion group. I was blown away. So thank you, Richard. He's going to join us for the first 20 or 30 minutes as time allows in our discussion group. But we're also going to be joined by a few of our evidence strategists evidence analyst from What Works for Health. So you're going to want to join us in today's discussion. And then we have some copies of Just Action that we want to grace you with. So please join us at APHA, visit our booth, and we'll share a copy of the book with you. As many copies as we can until we run out. And I know there's some of you chatting about wanting to do a book club. So hey, come see us, get your copy of the book, and then you're ready to prepare and prepared to be in a book club. So with that, I am going to turn it over to Joanne. And Joanne, I know there's lots of questions for Richard. So let's pause for a second and see what folks have been asking about.
Yes, lots of questions. So I'm first going to start off by saying that we will probably not to get to everyone's questions. And Richard, usually I try to group like questions, but there are so many that I am just going to pitch them to you in order. So they may jump from subtopic to subtopic, but we are at least being fair and doing them in order. So the first one is Carol asked, how have segregation policies affected community violence?
Well, when you concentrate the most disadvantaged young men in single neighborhoods without access to good jobs, without access to transportation to get to those jobs, it's inevitable that those young men are, some of them will be irresponsible, and some of them will be discriminated against by police. The confrontations with the police are inevitable when you have a concentration of people without hope, without opportunity. And so again, as I said, racial segregation underlies so many of our problems in society. And police abuse, mass incarceration, and violence are among them.
Yeah, thank you for distilling that so clearly. Christina's question is, she wanted to know your thoughts. Is the root cause of segregation encased in the doctrine of discovery?
I don't understand the question.
I think it has something to do with colonialism.
Well, that's a very interesting question. Of course, first of all, both the color and law and just action are based on the United States history. We have a very unique situation. We've got a constitution that prohibits all of the forces that have created racial segregation. Of course, the initial constitution that was adopted in 1787, that constitution permitted slavery. It actually protected it to some extent. And but in the aftermath of the Civil War, the 13th and 14th Amendments to the Constitution created an entirely different constitution. It became the most radically democratic document in world history. And if the Supreme Court had not begun in the 1870s to annihilate the plain meaning of the 13th and 14th Amendments and continued it to this day, we would have a racially egalitarian society today. You don't have to go back farther than the adoption of the 13th Amendment to find the causes of our racial inequality and segregation. The 13th Amendment, I won't go into it in great detail, but the 13th Amendment abolished slavery, but it also authorized Congress to abolish what we call the badges and incidents of slavery. That is, any form of second-class citizenship. Pursuant to the 13th Amendment in 1866, Congress passed a law prohibiting private and public discrimination in housing and the sale of property. In 1866, the Supreme Court prohibited its enforcement. In 1968, 102 years later, the Supreme Court said, whoops, we were wrong. The 1866 law really was a good law. Racial segregation, property discrimination in the sale and rental of housing has been unlawful for 102 years. But in the meantime, we created a segregated society that hadn't existed before. And the Supreme Court has prohibited, and continues to do so to this day, programs that would remedy that racial segregation that we created. So I don't think we have to go back to colonialism. We only need to go back to the annihilation of the 13th and 14th Amendments by the Supreme Court to understand why we're in the situation we're in.
Yeah, not that long ago. You are a walking encyclopedia. We are so privileged to have you here.
Well,
So this
in physics.
So this question is an interesting one, and just wanted you to speak specifically to how federal policies have negatively and inequitably impacted people or segregated them in rural communities as well.
Well, I can't. I wish I could. You know, I guess it's a good thing you misrepresented me as a walking encyclopedia. You asked that question, because the color of law is not really concerned with rural issues. It's not to say that they're not important. I hope the person who asked that question will write a book about rural segregation and rural inequality, and I'll read it, but it's not the book I wrote.
Fair enough. Fair enough. So another attendee is curious about your thoughts. Do you see a connection between the high rates of student loan debt among African Americans and not being able to buy a home as a connector of designed racism?
Well, it's a consequence of the wealth gap. Obviously, as I said, the enormous wealth that white families gained after being subsidized by the federal government to buy homes unexpectedly appreciated in value enormously. That wealth was used to send children to college and continues to do so. And so white children who have inherited wealth or whose parents have savings are in better position to afford college with lower student loans. Of course, college today is unaffordable for everyone, but whites for whites, it's less unaffordable than it is for African Americans, precisely because of the housing segregation that was unconstitutionally created by the federal government. So it all comes back to that.
Yeah. All right. So Alicia brought up a question kind of specifically, but I think folks are interested in hearing whether you think reparations is an approach to address segregation. And Leah's specific comment was around Black veterans and how they were blatantly discriminated against plans such as in plans such as Levittown, the underwriting manuals, and disregard of laws. Do you feel like Black veterans should receive a form of reparations due to those kind of discriminatory practices in the past?
Well, we don't talk about reparations. I'm sure you noticed that in Just Action, because we think it's amorphous, hard to calculate. It runs the danger of being paid and then people saying, well, we've taken care of that problem. We don't need to do any more. What we prefer to talk about is specific remedies to identifiable unconstitutional practices of government. And I think we can do that. And those, the question was about veterans. Well, there are very few veterans today who are alive, who were returning from wars during the period when these policies were implemented with their ongoing multi-generational effects. But we can trace the specific policies of federal government and find remedies for them. For example, we should be subsidizing. I'll take this, just using the same community as an example, but it's true all over. We should be subsidizing African Americans to move to Levittown today and to suburbs like that all over the country, because we can identify the unconstitutional way in which they were excluded. That's a specific policy remedy for a specific constitutional violation. Today, we passed the Fair Housing Act, and the Fair Housing Act said, in effect, okay, African Americans, you can now move to Levittown or any of these other suburbs if you want. The government's no longer going to stop you. But Levittown is now, as I said, unaffordable to working middle-class families of either race, really. What we should be doing is subsidizing African Americans to purchase homes in Levittown that would have been affordable to them had their parents and grandparents been permitted to accumulate the kind of wealth that whites were. Today, Levittown is about 2% African American. In a broader community, it's located in a broader community, broader neighborhood, it's about 13% African American. So the difference between that 2% and 13% is what's attributable to unconstitutional federal policy. And the remedy is obvious, what we should do with it.
Thank you. Well, Erica's queuing us. We've run out of our Q&A time, but thank you, Richard, for answering so many of the questions. Folks, I know there are lots of questions in the box we didn't get time to, but I encourage you to come over to the discussion group to continue the conversation.
Thank you so much, Joanne. And Colleen's now chatting out a link to our feedback survey. Please give us your thoughts about this webinar. We do read your responses, and they play a role in helping us decide which content we will bring forward in future webinars. So we appreciate you filling that out. And many of you shared an interest in learning more about partnering with faith communities. So next month, we will be joined by David Liners, the Executive Director of the Wisconsin-based faith-based, say that 3 times, faith-based partnership called Wisdom. We'll also hear from Catherine Lasada with Isaiah, which is a multiracial, nonpartisan coalition of faith communities, Black barbershops, childcare centers, and other community-based groups addressing racial and economic justice in Minnesota. So registration for that webinar is available now, and you can go to countyhealthrankings.org and go ahead and register for that webinar, which will be next month. Now, I hope you're going to continue to this discussion with us and move on to the discussion group. It's going to be facilitated by Joanne. They're very engaging. Again, Richard will be joining us. We'll have our What Works for Health evidence analysts who are joining us. They've been answering your questions in the chat as well as your questions in the Q&A box. You'll get to see them face to face. And I want to encourage you to stay in touch with us through social media and by subscribing to our newsletter. And I want to thank Richard for sharing his wisdom with us today. And to all of you, thank you for everything you do to advance equity in your communities. I hope to see you all in the discussion group, and I look forward to seeing you next month.